Should I postpone my COMLEX or USMLE? It's the single hardest question that I have to answer as a tutor, and I answer it for several students every single week. And almost all of them try to decide the same way on their own. They're usually staring at one number, usually their most recent COMSAE or NBME, typically at 2 a.m. when you finish taking it, naturally. And you kind of treat it like a magic 8-ball that's going to tell you your future. In my opinion, that's one of the most inconsistent ways to make this call. And there are actually 6 things that I look for before I tell a student to push their date or to keep it. Their most recent score is just one of them, but there's one that overrides every other score on the list. I'm Dr. Lucas, a DO, former medical school professor, and a full-time COMLEX and USMLE tutor with thousands of one-on-one tutoring hours, tutoring hundreds of DO and MD students across the country. I also scored in the 99th percentile on COMLEX, which I was very proud of, by the way, until I realized it doesn't actually get me any more matches on Tinder. I'm going to tell you about the 6 inputs that I run through with every student making this decision, and the one signal that overrides all the others, including how long to push your date back if you do postpone, and what postponing actually cost you. The first thing I consider is your practice score trend across the whole prep, not just the latest number, not the most recent one you have, but the shape of the whole trend line. Have your COMSAEs or NBMEs been gradually climbing over months? If those scores have been climbing, you're probably on track, even if the most recent one isn't where you want it to be yet. The first one, I'll just let them keep cooking for a little while on their own until we get another confirmatory score right around the range we actually want to be. The second student who's stuck at the same score for a while, I want to know what's going on first. But as long as it's nothing serious like nobody died or you just haven't gotten any matches on Hinge in a while, no problem. Some students will just get stuck at a certain score and never move past it. Some people will never hit the coveted 450 for COMLEX. That's okay. Honestly, as long as you're consistent, if you're consistently above the passing score, you're in a good spot. The second thing I check is your 2 most recent scores specifically. Were your last 2 COMSAEs both above a 450? That's the line I and most med schools use to call students safe. Now, it's not guaranteed that you're safe if you're above that 450, but there's some real data backing this number up. And the NBOME actually published a poster in 2025, and they said that a COMSAE above a 400 has a 94% chance of passing, and a score above 450 has a 97% chance of passing. So it's honestly not a huge difference, but that's probably where these numbers come from in the first place. Now, that's just one score. In my mind, if you can do 2 above 450 in a row, that kind of consistency puts you in a great spot to test soon. So aim for a 450, but plenty of students will never actually hit it in the weeks that they have to prep for this test. And that's okay. I've sent students in a war, in a battle with less. It's just what happens. Again, I'm more looking for consistency above 400. Say a little prayer, tighten my sphincter tone, take my nightly Xanax, and if everything else looks good, send them into the fire. If you're prepping for COMLEX level 2, I suggest you build a little more cushion in because I've seen students' scores plummet 50 to 100 points on level 2. So if we're just looking for passing on level 2, that's a 500 plus. Ideally, if you want to be safe, you want to be really safe about it. That's the only thing that lets me sleep without a bottle of Jack Daniels. Again, it's not impossible to pass without a 500 plus on level 2. I've seen many people do it. I've seen somebody do it with a 360 as their highest COMSAE score. It's just a little scary. So for my USMLE students, I try to aim for 10 points above the passing score pretty much across the board. For step 2, we're looking at a 228 and above. Again, I've seen students drop several points on the real thing, so it's good to have as much buffer room as possible. Number 3 is your question bank over the whole period. How are you doing in UWorld, your TrueLearn, whatever you've been grinding? Pull up the stats and check whether your percentage is moving up and to the right. Sometimes your practice test scores will stall while your daily question blocks just keep on climbing. And sometimes it's the other way around entirely. It's hard to say that there's any rhyme or reason to it, but as long as something is moving upward, that's probably a good thing. Ideally, it's the COMSAEs, the NBMEs that are trending up over time. The question bank performance matters less, but I would say most of the students that I see, they tend to have an upward trend, or at least a slight upward trend by the end anyway. Not all of them, but most of them do. So why does this matter? It's because practice tests pull from a smaller question pool overall, and so the stats on any one test can't necessarily tell you as much about the overall picture as, say, all of the question blocks you've ever done. If your QBank gives you a percentile, that's an even better indicator, and that's what I look for specifically, not percent correct, percentile. You only need to land somewhere around 5th to 9th percentile to pass COMLEX and USMLE. It's actually even a little lower for USMLE. I'd say it's closer to the 3rd percentile to pass that. Now, I can't give question banks too much weight in my decisions though, because you're probably not doing the questions exactly how you would be taking them for a test. For example, maybe you're taking them in tutor mode sometimes, or maybe you got a phone call in the middle of a block and you decided to take that instead of finishing the block. Or maybe you're eating, you're having some Sour Patch Kids, first they're sweet and then they're sour, and then I lose my mind. Woo! That's a scotch. These are all things that could happen on test day and hopefully aren't happening in your practice test, but then theoretically they could. So practice tests in my mind carry a little more weight in my formula. And the 4th one is where you stand right now this week. Progress on boards depends on the person. Sometimes it's a nice linear improvement over time. But for a lot of people, if you were to plot their scores over time, it looks more like a logarithmic curve where it's kind of slow in the beginning and then it shoots up right at the end. If anybody actually even remembers math. It's kind of like compound interest. So for weeks, it can look like nothing's happening. Then the scores just start making these big jumps right near the end. Eventually would plateau again if you kept going. To see where you're at in the curve, I recommend you look at your early question bank scores and compare them to this week's scores. Sometimes I'll even have students do like 2 to 4 mixed blocks for a more accurate picture. Right now, take that percentile, compare it to the percentiles you had earlier on. Because this recent window tells you where you actually stand today, which again, obviously matters a lot more than where you stood 3 months ago before your dedicated even started. Speaking of figuring out where your numbers actually put you, there's a free pre-educated school community where students work through this exact decision together. School with a K, because we're cool, also with a K. Inside the school, we'll find weekly office hours with real physician tutors who discuss practice questions with our students every single week. Over 100 practice question breakdown videos so you can watch how I actually think through a STEM. Instant messaging access to me if you've ever wanted to slide into my DMs. No paywall, no pressure, links in the description. 5th on my checklist is your schedule. Specifically, what happens if you have to postpone? Do you push your rotations back 1 month? Do you have to study while you're on a rotation? Or are you staring down the barrel of a leave of absence? Having to study for boards and rotate the same time, I promise you, that really sucks because you also have to do shelf exams at the same time. That's hard. That's really, really hard.
That's what she said.
But getting to practice medicine can also kind of pull you out of the burnout spiral a little bit. So it's a very real trade-off, and it's probably worth thinking over if you have the ability to decide that one way or another. A leave of absence is your school's nuclear option, though, and they will not hesitate to launch the missiles if you cannot meet their deadlines. An LOA can genuinely help your scores by buying you clean study time, right? You don't have to rotate at the same time. It's literally just more dedicated. Maybe you even get some time to relax before jumping back into studying, right? I mean, if you get multiple months, several months, a year, you're burned out, probably a good idea to start fresh, give yourself a little break, and then jump back into it. But it might push your graduation back, and you'll probably lose access to your student loan disbursements while you're out. I did the math on how much a year-long LOA actually costs between paying tuition, rent, and losing a year as an attending salary, and it turns out to be about $350,000. It's fun to play with make-believe numbers when they don't exist, right? It could exist if you don't take an LOA for a year, but whatever. Again, it's monopoly money at this point. Drop in the ocean. Number 6 is the one students miss the most, and it wrecks more scores than any knowledge gap ever will. It's really 2 things living in the same place, and that is your headspace. Break that down into anxiety and confidence. Let's start with anxiety. Ask yourself one honest question about every big standardized exam you've ever taken. Did I underperform on the real test compared to my practice tests? Did that happen more than once? If the answer is yes, you might have testing anxiety and not even know it. I call it the silent killer of board scores. I've watched students with 500s, 600s, I've even seen a couple 700s on COMSAEs walk into the test and fail. It's impossible to pinpoint exactly why it happens, but Headspace is my primary suspect. Let me tell you about Priyanka really quickly. She was a real student that I worked with. Now she's a first-year family medicine resident. Testimonial video right here on my channel if you want to check it out for the full story. Contact info is in the description too if you want to hear it from her straight. Priyanka came to me on her third and final allowable attempt at COMLEX level 2. She'd been scoring anywhere from 600s to a 900 on her COMSAEs, and her 2 real COMLEX attempts came back in the low 300s. That gap is not a knowledge problem. A student who scores a 900 on a practice exam knows the medicine cold, and she did. So what drops a 900 down to a 300 is what your nervous system does on test day. She was visibly nervous around even the thought of taking a practice test. So what we built for her was exposure. A ton of 4-hour proctored mock exams made as uncomfortable as we could possibly make them. The morning of her first one, she called me, said she was really nervous, and asked if she actually had to take the practice test. I'm like, that right there, that's exactly what she needed. Over a couple months practicing just like this, those morning of phone calls, actually they just stopped. They totally stopped, and that's how I knew it was working. She passed level 2 on that last allowable attempt with a 455, which is about a 70-point jump, and she matched into family medicine. Rest is history. If you recognize yourself in that pattern, the fix is not to just study harder. That's what she was already trying to do. It doesn't work, right? That's not the problem. Get mental health support going early because therapy takes time and a psychiatrist can take months. So don't try at the last minute to have a life-changing event happen where you finally sign up for therapy. Do it early. I'm telling you guys, it's important. Please, believe me. Okay, then I want you to build a buffer into your target. If your first attempt dropped, say a 430 down to a 380, you should probably be aiming for 50 points above that 430 then. Let's aim for a 480 this time. And be really careful with repeating COMSAEs. If you repeat them too close together, it's easy to get artificially inflated scores. That's probably why she got a 900 on a COMSAE in the first place. The other half of your Headspace is confidence, and it comes with a hard rule attached. Sit with the introspection question. Think about this. Do I feel more confident now than when I started studying for boards? If the honest answer is no, you should strongly consider postponing. So much of this exam rides on your headspace the morning of, and walking in already certain you're going to fail is just going to become a self-fulfilling prophecy at that point. Now, there's one rule that overrides every other point on this list. If you've had serious bad news recently, just don't test. I've seen so many students fail shortly after learning that a loved one just got sick or, God forbid, passed away, right? A death in the family, a medical crisis, even the end of a serious relationship that meant a lot to you. Any one of those is a postponed signal on its own, and a pretty strong one. No matter how good your numbers look, even if you feel pretty good about it, still, you might want to just take a couple weeks, just regroup, collect yourself. It's better to be safe than sorry. Okay, you've run the 6 and you've decided to push. So the question is how long? I like to postpone in 2 to 4 week chunks. I've seen real score movement show up on about a 2-week timeline. So pushing 2 weeks at a time lets you reassess with fresh data instead of just guessing at a date 3 months out. And try to resist the urge to push 3 months to be safe because a longer runway isn't necessarily free. If you stretch dedicated out too far, you start forgetting some of the early material and you start accumulating more burnout. One thing that should take some pressure off though, a postponement is not a failed attempt, right? It doesn't necessarily show up on your COMLEX transcript or your score report, but failing does, and it counts against your limited number of attempts. So if the real choice is between an honest 2 to 4 week push and rolling the dice on a fail you can already see coming, push it back every time. It's almost always the better move for your scores and for your residency application. Now, Dr. Lucas, should I postpone is something I get asked constantly. So I built a free postpone calculator that runs all 6 of these inputs together instead of just your latest score. You plug in your practice scores, your question bank data, any prior attempts, your anxiety, your confidence, and it'll give you a plain language recommendation with the reasoning behind it, and it'll graph all your scores so you can actually see the trajectory. It'll also show you confidence bands showing the range where you might land if you were to test on that specific date. I built this tool myself, and it's the exact logic I just walked you through and the same reasoning I use with my paying one-on-one tutoring students. If you sign in with an email, it'll even save everything for you. That way you can just take a new practice test, log back in, update that one number, and rerun the whole thing in a minute. We already pay for enough stuff in med school, so this one's free. Now, if you've run your numbers and you still don't know, maybe too many moving parts, a school deadline bearing down on you, a leave of absence question, anxiety history, whatever, my team and I run a free 45-minute strategy call for exactly that reason. The link's in the description. We build you a personalized COMLEX or USMLE plan live in our free study plan builder, and that plan is yours to keep whether you work with us or not. And we'll talk to you honestly about whether one-on-one tutoring even makes sense for where you're at. There's no hard selling. If the answer is, just keep going on your own because you don't need us, then that's the answer, and the plan's still yours. A postpone is not a failure of will, and keeping your date is not necessarily bravery. This is a data decision and a Headspace decision, both at the same time. If your last two scores clear your threshold, your trend's pointing up, and you feel more ready than the day you started, keep your date, go take it. But if something's off, your job is to figure out which one of those points might be holding you back before you walk in, not after. You got this.